Okay, thank you, everyone. I'd like to welcome you to our first town hall on disability and COVID-19 vaccination in California. This will include presentations from Stephen Kay, who's PhD, Professor Emeritus at the Institute for Health and Aging at UCSF, and also the board chair of the Disability Rights Education and Defense Fund as of last Friday. Sylvia Yee, senior attorney at DREDF, and Mary Lou Breslin, who's a senior policy advisor for DREDF. So thank you all for joining us today. Before we get started with the presentations themselves, a quick note about Zoom access. If you want to get the closed captioning, please go to the bottom of the screen. Look at the bottom of the screen for the CC button and click it. Captions will then appear at the bottom. We have our ASL interpreters, Mel and Tamara here. Make sure you're in gallery view. Click gallery view in the upper right-hand corner of your screen. Click the interpreter's videos, the little three dots, and select pin video. We'll also be putting this saving this and archiving it so you can see it later. Question and answers. We're going to save those till the end of the presentations. You can ask questions. We have a series of them that were sent via email. So we'll be asking those, and you can type your question into the chat panel. Raise your hand by clicking on participants icon, and then just click on the hand so that we can see it. We're going to start with a presentation from Steve Kay. Again, as I said earlier, he's going to talk about the elevated COVID-19 risks for Californians with disabilities. Steve is from the University of California, San Francisco, and the board chair of DREDF. Steve, it's you.
Thank you, Lawrence. Hi, everybody. So I'm going to talk about the increased COVID-19 risks that many people with disabilities face. And I want to just back up and talk about the two types of risk, which may be obvious to a lot of you, but let's start there anyway. So there's the risk of being exposed to the virus, of contracting the illness itself. And then there's a separate risk, which is the risk of having severe COVID, a severe illness, which results, say, in hospitalization or even in death. So those are two types of risks, and some disabled Californians are at high risk for each. Some are at high risk for both. So if you live in a congregate setting, like a nursing home or a group home, you're at pretty high risk for exposure. I mean, this is clearly one of the reasons that nursing homes were such a problem for COVID, especially early on. And if you're somebody who gets services at home or in a community setting from people who come in from outside your home, like attendants or healthcare workers, then you're obviously at an increased risk for exposure. A different overlapping group of Californians with disabilities are at high risk for severe illness or death if they contract COVID. Obviously, older people with disabilities, people with certain chronic conditions, which I'll talk about, people with multiple chronic conditions, and people with intellectual and developmental disabilities are also found to be at increased risk of severe illness if they contract COVID. Initial vaccine rollouts in California and elsewhere targeted people living in nursing homes and older adults, especially much older adults, and that was appropriate. But what was missing from that, and what's still somewhat missing, is non-elderly adults who are at risk, especially at risk for both of those types of risk, those people who get services in their homes or in community settings. Next slide, Lawrence. So why do we talk about age so much? This is a slide that makes it pretty clear that people who are very elderly are at much, much higher risk to COVID than younger people. For example, the risk is essentially zero in California if you're younger than 15 years of age, rising all the way to 885 per 100,000 population. So that's like 1% risk of dying from COVID if you're 85 or above. I want you to focus on the two numbers that are circled. 45 to 64-year-olds have a mortality rate of 63 per 100,000, and 65 to 74-year-olds have a mortality rate that's 2.8 times as high as that, namely 177.5 per 100,000 population. So the ratio of the two mortality rates is 2.8. Remember that figure, because I'm going to be comparing that, the age-related risk between those two age groups with the relative risk of people with certain types of disabilities. Next slide, Lawrence. So who gets paid services at home and in the community? Really what I'm talking about is IHSS recipients, people who get in-home supportive services at home, and clients of regional centers and other Department of Developmental Services programs, most of whom get services in their homes or other community settings. Now, I have national data that says that more than half of people who get these types of services, we call them home and community-based services, get services from workers who come in from outside their home. So that puts them at risk of contracting the virus in the first place. In California, we have approximately 300,000 IHSS recipients who are under age 65. There's data showing that the average number of chronic health conditions for IHSS recipients under 65 is 4.2. So there's lots of multiple chronic conditions. 84% have mobility limitations. A quarter use breathing equipment. And we know that breathing problems are particular risk when it comes to consequences of COVID. And among this group of people, there are also high rates of hospitalization and usage of emergency rooms. There are also in California about the same number, about 300,000 regional center clients under age 65. Most of them live in their family home, in a home that they own themselves, and a smaller number live in group homes. And group homes were not initially prioritized along with nursing homes, although the risk is quite high. Some group homes may have been vaccinated already, but some I'm sure have not been. It's hard to know exactly. And most people who are in this category who get these services need help with at least one of their activities of daily living. Next slide, please. So I did some analysis of survey data, and what we find is, this is national survey data, so it's not specific to California, but I think the California results, if we could get them, would be quite similar to this. There are a lot of chronic conditions, chronic health conditions prevalent among people who use home and community-based services. So I'm talking in California about IHSS and regional center clients. Hypertension and arthritis are present among more than half of people. This is among HCBS users under 65 years of age. Higher weight is about half of HCBS users have higher weight. Lung and breathing problems, 45%. About a third have a heart condition or diabetes, and about a fifth have survived a stroke or have epilepsy, and cancer and kidney disease and liver disease are lower than that, but still prevalent. Next slide, Lawrence, please. And there are certain conditions, this is hot off the press data, there's certain conditions that are more prevalent among HCBS users who are Black or Latino or Latina. In particular, hypertension is substantially more present among Black HCBS users than white. Higher weight is more prevalent again among Black than white HCBS users. Diabetes is more prevalent among Latino and Latina HCBS users than white, and stroke is more prevalent among Blacks than whites. Okay, so we have 4 conditions here, and remember the top 3 of those conditions: hypertension, higher weight, and diabetes. Now you can go to the next slide, Lawrence. these three same conditions are cited in a study that just came out yesterday, with thanks to Lawrence for having found this and sent it around. A study that just came out yesterday attributes a majority of hospitalizations, COVID-related hospitalizations in the United States for people between 50 and 64 years of age to those three conditions: higher weight, 35%, hypertension, 28%, diabetes, 22%. So, in other words, if we were to vaccinate everybody who had those conditions, we would reduce hospitalizations due to COVID by more than half. Okay. All right. So another study that came out in the fall analyzed hospital data and determined the extent to which different chronic conditions posed an additional risk of mortality, of death due to COVID. And this is a study of people under age 70. So they looked at a variety of different conditions for different types of cancers, depending on what type. They found essentially that if you had that type of cancer, if you had an active case of that type of cancer, you were between 2.2 and 6.7 times more likely to die of COVID. Okay. If you had a diagnosis of intellectual or developmental disabilities, just by having that diagnosis, you were between 3.6 and 4.8 times as likely to die. So the mortality risk was 3.6 to 4.8 times as high. Dementia, 1.8 to 2.9. Kidney or liver disease, 1.6 to 2.3 times the risk. Heart failure, 2.3. Mobility impairment, so any mobility impairment, 1.9 times, almost 2 times, almost twice the risk due to COVID. Epilepsy and pressure ulcers and chronic ulcers are also listed. Excellent, Lawrence, thanks. So the point is not really what those specific conditions that are listed on that slide are. It's really this slide, I think, which is if you have multiple risk factors, in other words, if you have multiple chronic conditions, which an awful lot of people who get home and community-based services, an awful lot of other people with disabilities have, if you have multiple risk factors, I mean, they're multiplicative, these factors that I showed you. So if you have two of these, what they call comorbid conditions, you have 2.8 times the risk of dying. Now remember, that's the same number that I showed you for the two different age comparisons, 2.8 times. If you have three, 4.8 times. If you have four conditions, 6.1 times. And if you have five or more, it's 14.3 times. It's really high. Next slide, please. So this is data that's quite recent and it's in flux. Some of these slides have nobody, even the dread of people, have not seen before. And it's clear, though, that certain disability groups are at especially high risk from COVID-19, both in terms of the risk of exposure and the risk of serious illness or death. IHSS recipients, who typically have between 3 and 5 chronic health conditions, have greater than 3 times the mortality risk of COVID-19 as people in the same age group without those chronic conditions. Regional center and DDS clients have between 4 and 5 times the mortality risk from COVID-19 as people in the same age group without intellectual and developmental disabilities. And that increased risk for mortality puts these groups of people in a risk category equivalent to other Californians in a higher age group. For example, IHSS and DDS service recipients between 45 and 64 years of age are at greater mortality risk from COVID-19 than the general community resident population between 65 and 74 years of age. So I'm basically saying it's a mistake to omit these people from vaccine prioritization. And finally, I need to say that Blacks, Latino, and Latina HCBS users are at especially high risk of serious illness. So there's an argument to be made for especially prioritizing this population. Back to you, Lawrence.
Thank you. So now we're going to go to Mary Lou Breslin, who will bring it down to sort of the micro level into Alameda County. Mary Lou?
Actually, I think that Sylvia's next.
Oh, Sylvia's next. Okay, Sylvia doesn't have any. Sylvia, please.
Yes. Hi, thank you, Lawrence. And it's always a privilege to be mistaken for Mary Lou. I have no problem with that at all. Hello, everyone. I've been thinking about how to prepare for this, and it's hard. It's like trying to describe a sunset in real time. Things are happening all the time. Colors are changing, and I'm not sure how to make things accurate. So I'm going to try to begin with looking at what has happened, who and why and when people with disabilities are going to be included in vaccine prioritization in California, and then look at the how, because the how is very, very complicated. The whole vaccine rollout has been complicated in the state. So in terms of the who, initially the state has been vaccinating its first category of people who get vaccines, and that's been they've been vaccinating people who are 60. They've been vaccinating people who live in congregate living situations, in long-term care situations, nursing homes, etc. And they've been vaccinating frontline healthcare workers. That phase continues now. They're still trying to get all frontline healthcare workers. Our interpretation has always been that frontline healthcare workers include home and community-based service providers, and also includes family caregivers. That runs into complications of how to establish that's what you are. But that's always been our position, that people who provide home and community-based services to others are frontline healthcare workers. The second phase included a number of essential workers, such as those who are in the food and agriculture sector, teachers and childcare providers, and emergency services workers, I believe. So that is a sort of a next phase, and that's continuing. And then the governor very clearly announced several weeks ago that people who are 65 and older would be prioritized for vaccination, and that we would be using an age-based framework going forward. At that point, and even before, many disability organizations and advocates have been fighting very hard to include younger people with disabilities who are at high risk from COVID-19. High risk being what Steve talked about in the beginning, who could be more likely to get infected with COVID, who could wind up with more severe illness from COVID, or who could die from COVID, an elevated risk of dying from COVID. So we've been advocating very hard for people aged 16 to 64 with high-risk medical conditions. And in February, the state did listen to us after we presented much of the evidence that Steve actually helped find, original evidence that he's provided on the high risk of people with disabilities. And so now the state has announced that some people with disabilities are included for vaccination. Here's where we get into exactly the who and when. Let's go into look into this. Let me pull this up. So February 12th, it was announced that beginning on March 15th, 2021, as vaccine supplies allow, certain disabled people aged 16 to 64 at particular risk for bad outcomes from COVID-19 will be eligible for vaccination. We like to think of it as being two large buckets. I know it's sort of, I'll just say it because it's easier to think of it that way. The first group, the first large bucket, includes individuals who are, quote, at the very highest risk for morbidity and mortality from COVID-19 as a direct result of one or more severe health conditions. And then California has listed a number of health conditions. So I'll return to that. That's the health condition group. Then there are also, in another second bucket, people with, quote, developmental or other severe high-risk disability, end quote, who are at risk of certain adverse outcomes. And the outcomes are listed. We believe those are two distinct buckets. So individuals who are out there who might not have one of the specific listed conditions, you could be in the other bucket. You could still qualify for vaccination on March 15th. Don't despair just because you don't have the specific listed condition. So that's the high risk disability group. So returning to the health conditions group, the listed health conditions include cancer, currently having cancer with a debilitated or immunocompromised state, chronic kidney disease, stage 4 or above, chronic pulmonary disease, such that you're oxygen dependent, Down syndrome, immunocompromised state, pregnancy, sickle cell disease, heart conditions, which are specified as well, severe obesity, and type 2 diabetes. So that's a finite list. This list might change in future. It's based on the federal CDC list of conditions, and that is a list of conditions that will change as new information and research is done. Forgive me, that's my angry cat who I can't make it go away. And then in terms of severe health conditions, that's the other bucket. So those are people with disability or other severe health conditions that are at risk of any of three outcomes. The individual is likely to develop severe life-threatening illness or death from COVID-19 infection. That's one outcome. A second outcome is acquiring COVID-19 will limit the individual's ability to receive ongoing care or services vital to their well-being and survival. And the third outcome is providing adequate and timely COVID care will be particularly challenging as a result of the individual's disability. So DREDF, along with other disability advocates, have been fighting very hard to say that all people who receive regional center services, all individuals who receive IHSS services, in-home supportive services from the state's Medi-Cal program, that these are all individuals who should be understood as falling in the high-risk disability group for a number of reasons. For example, if someone who receives IHSS comes down with COVID-19, is infected with COVID-19, it will make it very difficult for them to continue to receive the in-home supportive services that they need to get up, to eat, to toilet and bathe. These are essential daily needs with their life activities that are needed. And if someone comes down with COVID-19, it will be difficult to get those services.
Sylvia, I'm going to try sharing my screen and see if it works with the list of conditions and then the other elements.
Sure. And I think so. My colleague Claudia and DREDF have come up with a great fact sheet that we will be distributing, that will be available, and that also has a list in there. And the list is also available from the California Department of Public Health site as well. So I didn't mean to whip through it so that you have to take down notes, but it was just meant to give a sense of what's on the list and what isn't. So returning to the high-risk disability group, the same with people who receive regional center services, that it would be difficult for them to continue to get services they need, and as well for people, many individuals with developmental disabilities or other disabilities, if they acquired COVID-19 and had to be hospitalized, it would be very difficult for them, for some of them to keep an oxygen mask on or to be in the hospital without a support person. And while we strongly advocate that people with disabilities who have support individuals have the right to have that support person with them in the hospital, we also understand that those individuals are facing barriers sometimes at hospital facilities with keeping their support persons with them. So these are the examples of the kinds of reasons that we think people who receive IHSS services and people who receive regional center services should be viewed as belonging in the high risk disability group and falling in the group that gets vaccinations beginning March 15th. So next, I just want to take a moment to look at that date of March 15th. When this was announced back in February 12th, we knew it was a ways off. We advocated that the date needed to be sooner, and that it was important to include people with disabilities as soon as possible. At the same time, we understood that it was a victory because prior to that announcement, younger people with disabilities were simply not recognized. They were recognized way off on a 1C category by the state, and the estimate was that they wouldn't begin to get vaccination until June. So March 15th is still a couple of weeks off. It's closer than June though, and so we are working with what we have. Moving on to the question of how. Now this is a very significant issue I know for many of us, and I don't want to take up tons of time talking about this because it's in such flux as well. The state is working with a number of advocates. We're trying to figure out ways to make it as simple and efficient as possible for people with disabilities to get vaccinated once that March 15th date comes around. I'm going to step back for a while and talk about how and why it's been challenging. I think probably many of you have heard about how in the news or experienced yourself, flat out experienced discrepancies and difficulties with getting vaccination. I think at the state has 58 counties, and 58 counties have rolled out different kinds of systems for vaccination, and some have worked better than others, and some have worked better for people with disabilities and for caregivers than others. It has really been not so efficient in many places, and I know that Mary Lou will be going into more detail about that, so I don't want to dwell on it. At this point, the state is in a period of transition because California has decided that there needs to be more centralization with a third-party administrator, and that third-party administrator is Blue Shield. So the third-party administrator is now starting to get in contact with states, get in contact with counties, get in contact with providers, and is supposed to act as a centralized place that will know all the number of vaccine doses that are coming into California, that will know all the providers in California that are able to give vaccines out, and will have a sense of how many providers have how many vaccines. It's meant to be a centralized depository and a centralized way of applying for the vaccine as well. We are here, and the time when that third-party administrator takes over is over here. It's going to be in March. It's projected to be in March. We are in this state of transition. So it's going to be challenging. It's going to be challenging for the next few weeks. Go back to the things we know. People with disabilities are included in vaccination. Vaccination is supposed to can begin on March 15th. The third-party administrator has been told to emphasize equity. And that's one of the things that they are trying to really focus on, equity in the administration of the vaccine. There have been stories in the press about how some of the codes that have been provided to community-based organizations have been used by others who are younger and without disabilities and are white. So those stories are in the press. The state is very conscious of this and is also trying to look at equity. And right now, the third-party administrator is looking at equity in terms of through a geographic lens, and trying to emphasize the importance of reaching and giving vaccines to vaccine providers who are in certain zip codes, certain regions where there has been under vaccination. So that is the first wave that they're really trying to form these relationships with vaccine providers who are in certain low income, under vaccinated areas. How is that going to affect the inclusion of people with disabilities? It will affect it potentially in terms of timing. I think that people with disabilities, high-risk disabilities in either bucket who are in low-income areas may possibly have earlier access or can begin to sign up earlier, not before March 15th, but sooner after March 15th, than people with disabilities who are perhaps in wealthier zip codes. That's just one of the consequences of the geographic rollout. And this is sort of hot off the press information from a meeting I had this morning. But I know there are many, many questions, which I will try to be looking at as we go on. Another thing to note in terms of the work that we've been doing, the state's regional centers and Department of Developmental Disability has been working on getting a template, getting a letter out that will go to people with people who get regional center services, that they can be able to use this letter to authorize and to verify that they are a person who gets regional center services. The Department of Social Services that is working with that administers the IHSS program is also looking to try to get individualized letters out to IHSS consumers to help those consumers use a letter to verify that they are an IHSS consumer and therefore eligible for vaccination after March 15th. So this is, we're all working on trying to come up with the most efficient and simple, straightforward way. I will say that the last thing I heard from the Department of Developmental Services is that they are not sure that they are going to be able to get all those letters out by March 15th. So that's another reality. But the last thing I just want to address before turning this over is the idea of house call vaccines. This is something that the state is really thinking about a lot. And we've been trying to push them on that as well. There are people over 65 who have been eligible for vaccination for weeks now, who have been unable to get a vaccine because they can't leave their home. So that's also something that individuals are working on and that the state is working on. It's been hard to find providers who are able to go to individuals' homes, knowing that the vaccine spoils very quickly once it's open. I think for some of them, they have 6 hours to use up all the doses once it's open. So going to an individual's home will require administering the vaccine, staying around for at least, I think, 30 minutes to make sure there's no allergic reaction, and then moving on to another. It's a careful process and one that needs medical attention. So it's been hard to find providers willing to do that. The thought is that if the Johnson & Johnson vaccine, which is being evaluated today federally for its safety, if that is approved for emergency use, it may be a good candidate to use for home-based vaccinations. So I'm going to leave, there are so many more details and there are more town halls potentially to come that actually will be coming. So hopefully as we solidify and learn more about these details, we will be happy to share them with you and we will try to address the questions as much as we can. But I'm conscious of time and I want to give my colleague Mary Lou some time to address you all as well. Thank you.
Thank you. I'm going to move this back to the slides. Just one moment.
Well, hi everybody. We'll just wait a second while Lawrence moves the slides forward. I wanted to just begin by saying that we know that many of you are from many different locations around the state, and the discussion of what's been going on in our local county, Alameda County, may be less relevant to either your experience or the information that you hope to get from this webinar today. But we thought that it might be also useful to just talk a little bit about what some of the ways we can work with the departments of public health in our locales, and ways in which we can kind of move our disability issues forward through collaborations with these folks who may not necessarily be people that we're ordinarily working with daily in our advocacy. So I wanted to just share a little bit of my experience with being a member of the Alameda County Vaccine Community Advisory Group, which has been meeting every couple of weeks for the last, I don't know, 6 or 8 weeks. Our group actually is made up of a wide variety of people and organizations that represent the county's fairly diverse population. But before I sort of go into those details, I wanted to just mention that some of us who are on this committee who represent various aspects of the disability community have been advocating for a while to sort of think about how disability is actually represented in public health. Historically, I think most of you are aware that the disability community has had quite a bit of difficulty convincing public health community officials and practitioners generally that disability is actually a bona fide population demographic, and that we experience, health and healthcare disparities kind of at the same or greater levels as other groups do. Unexpectedly, though, COVID-19 presented this unanticipated and really kind of urgent opportunity for us to be able to raise our issues with public health officials. Certainly that's been going on at the state level, as Sylvia has alluded to. And in particular, we feel that it's been extremely important to be able to point out that disability has been left out of the health equity discussion for the most part. Although certainly in our county here in Alameda County, there has been very important emphasis placed on making sure that vaccine distribution, to the extent possible, deals with the equity concerns in the county, that the vaccines are targeted to both zip codes and neighborhoods that have experienced very high levels of health disparities and other kinds of problems accessing healthcare. Nevertheless, disability has never been included as an element of this health equity discussion. So the opportunity to raise it in the context of being an advisor to the vaccine rollout in the county has been really a good opportunity. It would have taken more years probably to have raised the issue successfully if COVID hadn't opened the door for it. So the advisory group has really opened up that opportunity. And for this reason, we also think it's really important for people with disabilities and allies to kind of communicate with your county health officials about these vexing problems we're experiencing in the vaccine rollout and the kinds of barriers that we're facing when we attempt to get the vaccine. We're also finding that people who are speaking out at the meetings, and I know that some of you are on this session today, really happy to see your names coming up on the screen. And the fact that you've been speaking out at these meetings and following up with emails and really consistently bringing the issues up to the forefront have made the issues visible, made disability visible. And in some cases, at least in our county, there's been some response to those demands and those requests for changes that are really important. So one example has to do with a wide range of accessibility issues related to accessing the COVID-19 vaccinations. So several of us on our local committee, along with a number of community members, have pointed out that the county website was inaccessible. So people who were trying to use screen readers and participate in the Zoom's advisory committee meetings just simply weren't able to do so. The meetings lacked ASL interpreters and captioning, And some of those problems have been corrected because of the very vocal concerns that were raised by those of us on the committee and by those of you from the community. So we've raised also a range of issues about physical accessibility of vaccination sites. There's certainly issues that they are now aware of because they've been raised by those of us who have been participating, and some of these concerns are being registered. Lawrence, can we go to slide 3, please? So one of our biggest challenges has been to convince the county officials that people with disabilities should be elevated to a higher tier for vaccine prioritization, just as it has been at the state level. At this time, Alameda County is adhering to the state vaccine allocation guidance, although other counties may be responding completely differently and may consider their rollout as being more flexible, and that they may have an opportunity to bring more people in that, but that is not the case in Alameda County. The counties recognize that family caregivers, as Sylvia mentioned, for people with developmental disabilities are considered healthcare workers. That has been an advance. The county's now vaccinating healthcare workers, people in long-term care facilities, people over age 65, food, agriculture, and restaurant workers, emergency service workers, and people in education and childcare. So can we go to the slide 4, please? So when each of these vaccine eligible categories within them, certain groups are also prioritized. These include older adults, people who have Medi-Cal insurance or who are uninsured, geographic areas within the county with high COVID case rates, and people who can't work from home. We'll just point out that the county's identified, I think, 7, maybe 8 zip codes that are high priority zip codes where they've really been attempting to target availability of vaccine. And these are communities that have been very significantly hit with COVID, both infection and death. I think one of them is the 4th highest in the country. Particular interest to us is that people with direct contact with clients, either in the public or at clients of the public or at their work, are also included in the priority categories of people who are receiving vaccinations now, assuming availability, of course, and assuming you can get an appointment someplace. This category would theoretically include non-IHSS home care workers. Expanded eligibility begins on March 15th, as Sylvia just mentioned, with folks with underlying medical conditions or a developmental or other severe high-risk disability, as Sylvia just discussed. Slide 5, please. So the county has also created partnerships in order to send out mobile teams. I think these are good ideas. This is an innovative way to approach the vaccine distribution, even though honestly it's been chaotic and difficult to figure out where these mobile teams are going and what they're doing and whether or not you can become a part of the group that's being vaccinated. In any event, they created mobile teams with pharmacies that are focusing on congregate facilities for people who have limited access to vaccination sites. This is based on factors like frailty, mobility limitation, limited transit, language barriers, and access to limited technology. They've also teamed with housing authorities, and they're offering vaccinations and senior affordable housing sites. They're going floor to floor in these sites and offering the vaccine, and they're also vaccinating IHSS workers and home healthcare caregivers at the same time who are in the building. Again, this is, it's hard to get information about how this is actually rolling out, but we are hearing that these methods are in operation and apparently are, they're beginning to make a dent. Can we just have slide 6, please? The mobile teams are also including what's called Stanford mobile vans. This is the Stanford healthcare system that's having vans in the community, attempting to find people who are going to be the hardest to locate and the most difficult to sign up for vaccines. These mobile vans are also being operated by Unlock and by the Alameda County behavioral health system. Can we have slide 7, please? So just in Alameda County, for those of you here in the Bay Area, vaccination sites are including the Oakland Coliseum, the Alameda County Fairgrounds. In Berkeley, Golden Gate Fields is operating sites a couple of days a week. Fremont High School is another site. There are many pop-ups that are coming and going. As Sylvia said, it's impossible to keep track of it day to day. And the community health centers are also offering vaccinations to people who are members of the health center system. This is actually a pretty good contact for those of you who actually are in that system. They have been vaccinating fairly regularly. It has been possible even for primary care docs to get appointments for people who are in that system. So if you're in it, suggest that you pursue vaccination through your provider. Slide 8, please. So I think everybody probably knows that also Kaiser, Sutter, Stanford Health, and CVS and Rite Aid are offering vaccines. This is not part of the county system. They don't have information about the supply and inventory. We all know that there's been 3-hour waits to try to get an appointment through Kaiser. But I think they are ramping up in terms of availability of vaccine. Similarly, that's the case with Sutter, Stanford. And as you probably know, if you've tried to get vaccine appointments with either CVS or Rite Aid, the appointments open up for about 35 seconds and then are gone. So the process to get a vaccine appointment is not transparent at all. And even so, there are some innovative attempts to get the vaccine distributed, I think, in Alameda County. And I think the pressure from the disability community has been very helpful and productive. And it does not mean we're getting what we want or need necessarily, but I do think that we have a foothold in terms of being able to have an impact on the process to some extent. So I'm going to just stop there and see if we'd like to just answer some questions that we've either received in advance or that are in the chat.
That's great. Let me look and see what's in the chat here real quickly. I think what I could do is go ahead.
I was just going to answer one thing, just talking about the codes, because that's been coming up, and I think it's both in the chat and Mary Lou and I mentioned it, and I did. One of the things that the state was trying to do as an innovative measure was to distribute some codes to certain community-based organizations to make available to individuals. And the codes would allow someone to make an appointment for vaccination without necessarily establishing a verification. And the codes were meant to be controlled strictly, but some of them have gotten into the communities. So for example, in LA, there has been some abuse of that. So the codes now no longer work, they've been stopped. I think in future, the third-party administration has been thinking about making codes available in a more controlled way. So they would go to a community-based organization. And the community-based, it could be an organization that's particularly serves the healthcare needs of a racial or ethnic group, or possibly of independent living centers that serve people with disabilities. And they're intended to be available so that that community-based organization will be able to make vaccine appointments for the individuals they know qualify. So it's a more controlled kind of code. For the use of those codes, probably no further verification would be needed, because the trusted community organization is sort of in charge of understanding who needs those codes and who can use them. I just wanted to bring up that point because that's a pretty new development in thinking.
Yes, thank you, Sylvia. Much appreciated. I wanted to pop up these slides while we're getting to the questions so that people can be abreast of where there will be future resources and what they should be looking for going forward. Our web pages at dredf.org, dredf.org. We'll be posting information regularly. We'll have more vaccine information. It's going to be launching next week. That's why we wanted to do this today, to kind of give people a heads up for that. We'll be doing these kind of town halls monthly and regular weekly Q&A sessions. Information about that will be circulated soon. I wanted to also, while we've got everybody here, just give you there's some additional resources and places that you can click, link, or connect to, so that you can get that information. One is DREDF's COVID-19 advocacy and resources page, which we've been updating regularly since last spring at dredf.org, COVID-19-advocacy-and-resources. We'll also have, which we just created, our frequently asked questions on COVID-19 vaccines and Californians specifically with disabilities. And we encourage people to subscribe to the DREDF monthly newsletter and to regular updates so you can get the most up-to-date information. So thank you. We'll be also sharing these slides and part of the presentation within the next week. So just make yourself available to all those resources and get signed up for them so that we can get the most accurate, up-to-date information to you. Let's see, I'm going to see if I can get, yes, Sylvia, you had something else you wanted to say?
Yes, just something to add about vaccine providers. I think the state's plan and the third-party administrators' plan is to eventually try to get as many different types of vaccine providers on board as possible, from like the big Kaisers all the way down to smaller individual providers, actual like the doctor that you regularly see. But here we face the reality that of time again, because every provider needs to sign a contract with a third-party administrator, and I think they are trying to get sort of bigger bang for the buck right now. So they've made a contract with Kaiser. They'll be making contracts with federally qualified health centers, providers that can reach more people, and providers that can reach more people who are of racial and ethnic minority that have been dying from COVID. It will eventually get down, hopefully, to the level of individual providers, which also should help people with disabilities, because we go to many different kinds of providers, right? And a provider that already knows your health condition and why you are at risk should be, that'd be the great person to be administering the vaccine to you. But that's not going to happen by March 15th. So I just wanted to put that out there as well.
That's great. Thank you, Sylvia. I appreciate that. People were wondering where they can find a list of the qualifying disabilities that that are likely to help one be able to get vaccinated. Does anybody have that information to share?
I'll put that in the chat right now.
This is Claudia. I have been sharing the FAQ, which has the list of conditions, and it has the description of the second group, the high-risk disability group, and sort of some examples in each group.
Wonderful, thank you. Again, are there other questions? I know they've been going in the chat room as we've been discussing here. Did you see things that rose up in the chat room that you'd like to specifically address in the Q&A format publicly here?
Lawrence, this is Mary Lou. I just wanted to mention that for people who are in the Alameda County zone, if you have specific issues that you would like us to raise with the Vaccine Advisory Committee, please let us know. You can put that in the chat or send it to us by email separately. We're really happy to convey everybody's concerns. I'm sure there's ones that we haven't thought of up to now, so please communicate with us about those. Thanks.
Thank you. Okay, well, we've got to wrap this up now. So I want to thank everybody for participating. Again, go to dredf.org, sign up to get those resources, and send the questions to covidquestions@dredf.org. Thank you again, and we'll see you again soon.